Welcome to our panel about research and community work during the COVID-19 pandemic. In the next hour, you'll get to learn more about the phenomenal fieldwork and practica that students are doing even in this really challenging, different time that we're living through. My name is Sarah Dillard, and my pronouns are she, her. I'm the advisor for the Health Metrics and Evaluation track of the MPH. And in some ways, this panel is an offshoot of the Department of Global Health's annual Global Healthies event, which is an opportunities fair that provides students with the opportunity to network with UW community members and local organizations and to learn more about the research that's happening in the department, at UW, and further afield. So we're really excited for this opportunity to spotlight the work of our current students and hope that the work they've been able to complete even during this really difficult time inspires you. I'm sure they will say that it hasn't been easy, but it's possible. And now I'm going to ask our student panel to introduce themselves. So I'm hoping that you all can share your name, of course, your year in the program, which program you're in, and which track. And then a really, really high level summary of your practicum project. So we'll come back and be able to talk a little deeper dive later on. But if you can just give a quick blurb, that would be wonderful. And I will just kick things off by asking if Mita can go first.
Yeah, sure. I'm Vita Sahu. My pronouns are she, her. I'm a second year PhD student in global health metrics and implementation science, and I'm in the metrics track of the program, which means I primarily work with the Institute for Health Metrics and Evaluation. I focus mostly on health economics and health financing. At IHME, I work with the resource tracking team, estimating disease expenditure in the US. And I worked for the summer and fall quarter. I took a pause from IHME and worked with the Department of Global Health with Professor Bruanne Barnabas on estimating on cost effectiveness of community delivery of HIV care in South Africa. I don't know if we wanted to give a more of an explanation right now, or we're going to come back for that. But
I think we'll come back and you can provide a little more detail. Thank you so much. Tikala?
Hi, everybody. Good evening from all the way from Malawi. I am a second year MPH student, Global Health. I'm in the Leadership Management and Policy track. My pronouns are she, her. And for my practicum, I think what you saw on the write-up, I shared about my thesis. So my thesis is on looking at the perspectives from program managers and non-governmental organizations across 19 countries on issues of neglected tropical diseases and mass drug administration. Last year, the World Health Organization pretty much sent an order on measures around mass drug administration around issues of neglected tropical diseases. So I am in an existing study that's happening within UW, and I'm supporting data analysis with Professor Ariana Means. She's the one leading this, and I'm supporting her on it. And my practicum was last year summer with the Bill and Melinda Gates Foundation gender equality team. And I supported them to do some internal research around assessing unintended gender-based violence, unintended consequences of gender-based violence around the grants that they awarded across 15 different teams across the whole foundation.
Wonderful, thank you. And Leah?
Hi, my name is Leah, and I'm a she, her pronouns, and I'm a second year MPH student, as well as a concurrent MPA student in the Evans School of Public Policy and Governance. For my practicum, I worked with a team of interdisciplinary researchers from the School of Forestry, as well as the Nature Conservancy and the Department of Environmental and Occupational Health Services at UW, looking at the human health and health equity trade-offs of prescribed fire versus wildfires, with a focus on the West Coast of the United States. And then from there, I've kind of spurred off into a few different projects. Hopefully one of them will be my thesis, focused on doing a policy analysis, as well as looking at risk communication for communities in the eastern part of Washington state.
Wonderful. And Brittany?
Hey y'all, my name is Brittany Sheena. My pronouns are she, her, and I'm a second year Master's of Public Health student on the Global Health Metrics and Evaluation track. For my practicum, which I worked on in spring of 2020, so just as things were picking up with COVID-19, I worked with the Institute for Health Metrics and Evaluation on their COVID-19 task force. The two principal projects that I was working on were evaluating excess mortality and using that information to see how we can estimate COVID-19 in areas where there was underreporting or lag in reporting of COVID-19 deaths. And then I also worked on producing a seasonality covariate in order to try to forecast trends of COVID-19. And through the two different projects, they helped aid in understanding the global distribution and potential trajectory of the pandemic.
Perfect, thank you. And we will have one more panelist, Sarah Smith, joining us about 30 minutes after as well. All right, so to get started, I'm curious to hear how you all found your fieldwork opportunities. And feel free to jump in as you'd like.
Yeah, I can go. My project just kind of came up. I took a implementation science class in the spring, and Brianne Barnabas, who's the PI on this project, she gave a lecture for one of the classes. She's an infectious disease modeler and health economist. And I just reached out to her to connect. I wasn't necessarily planning to work on a project with her or anything. It was just to connect because my background is, I've worked on cost effectiveness analyses related to infectious disease and also costing for soil transmitted helminths and other infectious diseases. So I reached out to her, and then she mentioned that they'd already done this clinical trial, this randomized trial in South Africa, evaluating the impact of community-based delivery of HIV care using mobile vans, and that it had shown really high success. They were publishing the results in Lancet Global Health, and they wanted to also do an additional analysis of the cost effectiveness of this intervention. And based on my background, it would be a good fit to start this over the summer. And so it sounded like a really interesting opportunity. And I worked on it over the summer and in the fall. I was able to kind of, take a pause from IHME and return now again in the winter quarter. So it wasn't like I was struggling to find something. It was just an opportunity that came up. And I think there's quite a lot at UW.
I can come in as well. Let me start off with the practicum. So I got my practicum opportunity with the Bill and Melinda Gates Foundation through, I think the foundation reaches out to the Global Health Department and different departments at the School of Public Health. I think also the Evans School, they also reach out to the Evans School, pretty much asking for graduate students who are interested to be some associates to apply. And so pretty much students apply and they go through a screening process and they try to identify students that kind of meet particular criteria they're looking for specific projects within the foundation. So you could be placed in any team. Like you don't really select, oh, I want to work with the maternity, newborn and child health team, or I want to work with the gender equality team. So that only happens through the initial screening process. I had gone through about 3 interviews. And they make the final decision in terms of based on this person's expertise, who will place her, she's best placed with the gender equality team. And then they give you your assignment and you get to work with them. So that was my experience with that opportunity. And then around my thesis, funny story, I initially wanted to I had my own project. I was passionate about water and sanitation. And I was like, I want to go back to Malawi, do my own research, data collection, the whole lot. And I approached one of the faculty members to be my supervisor through this journey. And then along the way, we went back and forth. I already put a thesis proposal, talking to a few people around in Malawi around the topic I wanted to do around WASH and budget tracking. And along the process, we sat down, we're like, okay, this looks like a lot of work. are you sure you can do this? This is 1 year, you've got a few months to go. And I got to a place where I was like, okay, I don't think I've got enough time. And, you know, I think being at a place of really listening to your faculty supervisors for any thesis will really guide you, because through that, she connected me to Ariana Means, who was working on certain projects around not exactly WASH, neglected tropical diseases is related to kind of sanitation issues. So it's still aligned to something I was still interested in. And she already had a study happening in Malawi, a deworm project. I'm sure maybe some of you guys have come across it. I initially wanted to be part of the deworm project, but through that process, I started joining some of the meetings they had. It's like, oh, I don't know if this is really me. And then started talking to Ariana and being like, are there any projects you're doing? I think I just want to focus on data analysis. I've only got a few more months to kind of get my MPH done, and I don't think I can do my own data collection and my own research. Can I work with any existing research that you're doing related to issues around water and sanitation? And then she told me about the work she's doing around COVID and mass drug administration in neglected tropical diseases. By the way, I have no expertise around neglected tropical diseases. I literally learned on the job, like they call it. And yeah, an interesting challenge. I have a faculty member that's really supportive, that learned so much. And yeah, it's a project that is being led by the World Health Organization and the Bill and Melinda Gates Foundation as well. So it's kind of nice that I'm doing data analysis with something that's going to contribute to innovation and reprogramming issues around mass drug administration and neglected tropical diseases. So in all, I'm not doing what I really wanted to do, but I've been placed in an opportunity that's going to challenge me, I guess, and do something different. So.
Thank you.
I'm happy to jump in as well. So for me, when I started with the global health program, I wasn't really sure where I wanted to focus my efforts. But I started going to a few different meetings with folks who are working in more kind of interdisciplinary spaces, which I found really exciting. And I found out about June Spector, I forgot to mention that, she's the faculty I've been working with, and thought she just seemed really great. We had a couple phone or Zoom calls, and then was planning to work with her on a different project focused in Indonesia, but this other project came up and it seemed like a really good opportunity. So after I completed the policy analysis for my practicum, I kind of just kept attending meetings and meeting different folks who had been involved with the project, and became part of a team focused on wildfire smoke and health, and looking at how we can start designing risk communication to be more family-centered in heavily impacted areas in our state. And from there, have been working on a proposal that we're waiting to hear back about funding for, that's going to be my thesis project. And so kind of in short, I reached out to someone that I thought was really interesting. I didn't really have an agenda going into it other than just like, hey, you seem really cool. Like, let's talk about what you do. Why are you motivated by what you do? And found that we really clicked, and have since had opportunities kind of open as I've continued with this work.
Wonderful.
And I can carry the tale. So I also work at the Institute for Health Metrics and Evaluation, but I work on the global burden of disease study doing hepatitis and cirrhosis disease modeling. And back in around March, the University of Washington had reached out to IHME and asked if they could do any sort of assessment on COVID-19 and the trajectory in order to help the University of Washington better prepare hospital resources based off of the increase in likely cases and deaths. And so I had initially volunteered to be on the COVID-19 task force, which would have meant that I would have gotten rid of my normal GBD responsibilities and been a primary principally working on the COVID-19 task force. And I wasn't initially selected, and I ended up just reaching out to one of the senior faculty saying, I'm interested. I know that I can't switch out all of my time to work on the COVID-19 task force, and they found a place for me to work on it. And it was a way that I really wanted to spend my time at the beginning of the pandemic, giving back and contributing. And then there were a couple of different projects that just kind of arose, and they started transpiring into my practicum. So similar to a lot of the other panelists here, I think that just reaching out, if you have an interest in any area, and connecting with faculty. If you're interested in something, I found that people at the University of Washington really, really want to help support projects or goals. Yeah, so definitely just ask.
That's great advice. Thank you, Brittany. Takala talked about this quite a bit, but I'm curious to hear how your projects changed over time. If there were any kind of detours, surprises, if you landed somewhere unexpected.
Yeah, like for me, I started out the summer thinking I was going to be doing a policy analysis of barriers and opportunities for kind of moving forward prescribed fire on the West Coast, and didn't think I would actually be that interested in that project. It sounds kind of dry at first, but then you start diving into it, and there's actually like a lot of really, really interesting history behind it. There's a lot of human rights issues at stake, and it's a big health equity issue. And for folks that were living on the West Coast, wildfires were obviously a huge thing here. And so it kind of provided a little bit more urgency to my work, which made me more interested in continuing with it moving forward. And since this is a pretty understudied area, there have just been a lot of opportunities. So I'm giving a presentation with the Washington Prescribed Fire Council next week to just sort of continue working with different folks, as well as being able to sort of implement some of the recommendations that we put forward, which is the focus of my thesis, is really working with community members to figure out what's working for them and what's not. So being able to take what I learned during my practicum and apply it into a thesis project has been pretty cool.
Yeah, for me, the scope of the project was the same from the beginning to the end, but I think just the opportunity came up kind of because the PI was working on so many COVID projects, and just kind of wanted to hand this part off. And I think the things that changed were just the implementation of it. I mean, the beginning, or maybe what I wasn't expecting, is that it would be so independent, because I think my PI was so busy, especially in the beginning of the summer, working on all her COVID projects. So it was really, I was working with another mathematical modeler on this project, and it was just the two of us taking it on. And yeah, I mean, that has been a really interesting learning experience. I hadn't really I'd worked on cost effectiveness analyses, but not cost effectiveness analyses from mathematical models. So working together with the programmer on that part of it has been a really interesting learning experience, and also just kind of doing it, going forward on our own. And then later, Ruann, towards the end of the summer, I think things calmed down a little bit. So then we've been meeting weekly since then. And yeah, it's just been a really nice opportunity, and obviously all the data is here and working with the model. So it's been possible to do it from here in Seattle, even though the main trial was in South Africa.
All right. Oh, go ahead, Brittany, please.
Just briefly, I also didn't expect the level of independence that I received working on the project. And when I had initially asked, I wasn't even quite sure what projects I was going to be working on. And because I was working at the start of the pandemic, I ended up meeting with my supervisor, which was Teo Voss, every single day, just to assess models and figure out where we could get more data from, and really like evaluate what we were doing. But yeah, I feel like I had a lot of flexibility and adaptability, because we just didn't know what was going on and what resources were, like personnel resources, were necessary.
Yeah, I actually just wanted to quickly jump in to just also add to say, I think the biggest thing of learning that I had and how the changes happen was through just talking to faculty members, because you can start off with like this big idea and you're so passionate about it. And then I've had, I had approached different faculty members that have been doing work aligned to those issues. I know I had several calls with Steve Gloyd and Donna Dina, if anyone's taking classes with her. And just having those initial conversations and brainstorming with someone else who has had expertise in those areas was super helpful to try either narrow down your topic or try figure out what other avenues you want to go into, but also was also an opportunity to also see how best you can identify what topic you want to do, because you never know, they could be existing studies happening within the Global Health Department or any other department where you could work with, making your work less easy, making your work less easier, I guess, because I think most of us, we're kind of start off with this ambition of saying, I want to do my own data collection and just go full on it. But I think when opportunity arises for data analysis, it's something to jump on.
Mm-hmm. That's great advice. So I imagine when all of you entered the program, when you were starting to think about fieldwork, your vision might have looked a little bit different of what things might be during this year that we've been dealing with the COVID pandemic. So I'm curious to hear about what doors closed for you because of the pandemic, and then which doors opened because of the pandemic.
I can kick things off. For me, I had initially entered the program thinking that I was going to do in-field work abroad. And so because of limitations on travel and uncertainty about when that would open up, I had to completely rethink about where I was going to do my practicum. But it was also a way for me to really connect during hopefully a once in a lifetime event, and like contribute back and apply my global health skills in like a very, very applied way. And one of the covariates that I worked on ended up it was one of the main predictors in our model trying to drive estimates and helped IHME's estimates predict the second wave. And so it was something that I could talk about of, all right, we're modeling during the summertime, but I'm really nervous because the work that I'm directly focused on is saying that COVID-19 is only going to increase from here in the Northern Hemisphere. And that is something that we've seen. So I felt like there was like a very direct personal connection to the work that I was doing that I may or may not have been able to have had I, gone abroad and worked on a different project that I'm not entirely sure what I would have focused on anyway.
Yeah, I think because my program, we work primarily with IHME, which mostly does modeling from here. I was never really expecting to do field work the same way. So it didn't change that much for me in terms of that. I think what I was hoping to do is attend more conferences, and those are obviously all virtual now. Yeah, which has been disappointing because I think it's just it's not quite the same going to them. I went to one over the summer that was online, and it's really just not the same feel to it. So that's been disappointing, but that's yeah, for everyone. We're all facing that together.
Yeah, for me, my practicum was always intended to be virtual, so it didn't really make that big of a difference. But I do feel like one door that kind of closed was being able to hang out with classmates before and after class. In terms of like the connections that you make with folks, they're just good people, so it's really fun to hang out with them. And like that's just like a really unfortunate side effect of like both of the classes, as Mita was saying about like conferences as well, is not being able to have that in-person interaction has been tough. Mm-hmm. But in terms of practicum and thesis work, like we're having to think about like how we might do virtual data collection for my thesis using phones, or like it's like switching to more interviews as opposed to focus groups to be able to socially distance and do them outside if need be. But we're still kind of figuring that out, and that's really been the biggest impact in terms of fieldwork. Mm-hmm.
I think on my side, it's been the one-to-one interaction. I think I'm a one-to-one person. So if I want to get advice about my thesis or practicum opportunities, I like to meet people in person and kind of talk about it. I think even trying to identify for practicum opportunities, like you'd want to visit the organization and get a feel for it, you know? So having to kind of just depend on just sending emails to people and be like, hey, I'm looking for opportunity. I know you don't know me, but I think that was always the hardest part in terms of how do I start when I want to get opportunities as a research assistant or some practical opportunity. I think that was the hardest. But I think being at a place of reaching out to faculty members and just being intentional about that and getting guidance from them, any direction. And also you find that faculty members could also make a reference for you. So in terms of if there's like an organization you're interested to do your practicum, you can easily ask a faculty member saying, hey, I see you've worked with this organization. Can you send them an email saying I'm interested to do my practicum with them? So, and those introductions have also been helpful. So those were opportunities. I'm also part of the Global WASH Certificate Program. So, I took advantage of people who are also doing different studies and working with different organizations within Global WASH. That also helped me kind of make those connections. So, but yeah, it's been my experience.
Thank you. What classes or skill sets have been most helpful for the work that you've ended up doing for all of your field work?
I found that qualitative, so I'm not a quantitative person. Luckily, we have a few folks here that are. But for me, like I definitely prefer qualitative research. So being able to work with words as opposed to numbers. And I took a class with Dr. James Pfeiffer last spring, focused on advanced qualitative methods that I thought was really helpful. Just for thinking through both like how to put together a proposal as well as how to go through qualitative project planning, analysis, everything. That's been one of my most helpful classes.
Yeah, I found that having the experience in cost effectiveness analysis, or just like having, as you're saying, Leah, having a qualitative background or having like one specific thing that one skill that you know or are familiar with kind of helps, because then like the PIs could be like, oh, I have this type of project that we need. And I think with costing, a lot of the projects have a cost effectiveness or costing component to them. So I think that's quite a useful skill with a lot of these larger global health projects.
Yeah, gosh, it's a tough one. It's so hard for me to kind of pinpoint each course. But I would say biostats. I hated biostats and I couldn't believe how much I needed it when I got my practicum and my thesis, because I was like, I remember when I started my first year, I'd go to Andreas and be like, do I really have to, is this mandatory? Like, do I really have to do this? But it's mandatory. And I remember going through biostats and epidemiology and all these kind of really hardcore stats stuff, and thinking I'm done with it. And then when I got into my practicum with Gates Foundation and having to do some sort of analysis and some sort of research internally, I had to apply some of these skill sets. And even with my situation with my thesis, even though I wanted to go independently and do my own kind of research topic, now that I'm working with an existing study, initially it was supposed to be qualitative and I was like, yay. And then later on it changed and say, oh, wait, there's a bit of, quantitative data. So you have to do a mixed study method. And I was like, oh my goodness. So at the beginning, you may think you don't need certain skill set, but I think my advice would be like, take advantage of all these kind of key kind of biostats, epidemiology, qualitative analysis classes, because whatever opportunity you may get around thesis or practicum, you may need to apply those. So, yeah.
I also was very daunted by biostats. I took the first course in the series and was like, I'm in a quantitative program. What am I doing? And then am currently taking the second biostats course because I realized that through practicum and through other work opportunities, I just didn't have the strength of quantitative, like technical skills that I wanted. And so I think like if you feel daunted by any of them, keep on pushing through because the professors are great. If you have the opportunity to take a class with Amy Willis, she is fantastic and humorous and super engaging. So I highly recommend continuing on.
Thank you. And just to clarify for our admitted students, the curriculum has changed a little bit. And so students are now getting the biostats and epi series or portions of it in the PHI courses that they're taking across the School of Public Health. So it's the same content that you'll be learning, but it's packaged a little differently. I'm going to have one last question here, and then I'll turn it over to our audience. What did the time commitment look like? So how much work were you doing? How did you space it out? How did you balance it with everything else that you have going on?
So I worked over the summer, I worked full time, and then in the fall, I worked. I mean, we worked 20 hours a week. It's definitely challenging to manage all of it. Also because I'm still involved with the team throughout this time. I was involved with my team at IHME as well, so volunteering with them. So yeah, we take full-time classes and then also have an RA shift to balance with it. So it definitely gets very busy. But I think, yeah, and I think I also, I thought I would be able to wrap up this paper from just over the summer plus my fall RA-ship, and that hasn't happened. So the timeline's getting stretched out a little bit longer. So yeah, it's definitely busy. But also I think the PIs are quite, at least everyone I've worked with has been quite understanding that we are students first and classes come first. So I think they're quite flexible in understanding that, but it is a lot. But I think I've really liked that I get to, like whatever I learn in class, I get to apply it immediately working at IHME or with Ruan also, because, as you're saying, like all these kind of difficult biostats concepts, or I had never used R before last year when I joined, and just through those biostats classes, you get a little bit of that, but then really being able to apply that at work kind of solidifies it. So I found it really valuable.
So for me, for my practicum, I worked about 15 hours a week during the summer, and then have since kind of stayed on in a less formal capacity. So joining in on like the core group monthly meetings, as well as kind of working on these different sort of like branch projects that probably ends up being about 20 hours a month. However, what I found is that writing my final report of my findings and then communicating it took a lot more time than I expected. Just in terms of being able, because I was doing kind of like working group and community engaged research, being able to send it back to folks, get the revisions, kind of do an iterative process took a lot longer than I expected. As well as, like when you have something great that you want to communicate, it takes a lot of time to put together those materials and to do the presentations and to reach out to folks. Usually somebody knows somebody else who wants to see it. And so, which is a great thing, but it does end up taking a lot more time. So I found that end of things has taken much more time than I expected compared to the actual collection and analysis.
Yeah, and on my side, timing wise, and it really depends on, for practicum, it depends on which organization you're working with and, how their working hours are. They flexible? Are they not? So when I was working with the Gates Foundation, because everything was online, there was a bit of flexibility, but it was hardcore meeting after meeting. I found myself working Monday to Sunday, which is crazy. But it really depends on which team you're working with the foundation and what they're working on. I was part of the gender equality team where it was just a new team that was set up and was only 1 year old, and they were putting together a new strategy. So I had to review about 80 different grants across different teams. So, and I had deadlines and a timeline to meet certain deliverables and to also present on the findings. So that for me, I literally was working like all the time. So with practicum, I think it's really all about who you're working with and what your project you're working on and how demanding it is. For my thesis, I think my advice, especially around timing, would be to be aware of kind of key things that you need to put in place, whether you need to get approval from the review committee as well. I remember when I wanted to start with my own research, I didn't factor how long that takes to get an approval. So that was also one of the factors that ended up putting me in a place to say, I might as well just work with another existing study and do data analysis, because the review process from the review committee can take some time. And then the other thing also on timing has been the availability of your supervisors. You can start the process, you can put a timeline and say, I'm going to get the proposal done by this month and start analysis on this month and so forth. But you find that faculty members are also busy doing other stuff and other work, and they're teaching and they're part of other projects. So getting feedback from them may not just be like, I send it today and get it back tomorrow. Others would be like, I can only give you feedback after 2 weeks or a week. So there's also kind of that timing you have to work with. So yeah, so there's a lot of kind of little things that you have to think about. And I think for those who wanting to do their research abroad, I had a situation where I was heading back to Malawi, and there was a process I needed to do in terms of apply with the UW abroad department, and it took a process. It was a process as well. You have to apply, you have to get the approval, and so there's a lot of kind of little things that you kind of need to think through when you're timing your thesis or things around selecting which practicum and which organization you want to work with. But it really kind of depends on a lot of factors.
And then for me, I think that my experience was a little bit of everyone's experience, where there were some weeks where I was working 20 hours. There were other weeks where I was also working from Monday to Sunday. It kind of depended on what deliverables other groups were asking for us when. And so there was one point where we were working on the excess mortality model, and we were working constantly because we needed to finish them in order to produce estimates in Latin America, because PAHO was asking us for them. And so us not producing that deliverable was delaying them understanding what the burden of COVID-19 was at that point in time. But for me, I knew that working on this task force was something that was really important to me. And so Sarah Dillard is actually my MPH advisor. And so I connected with her about how do I balance being a full-time employee at IHME? How do I balance being a part-time student, master's student, and what classes I should be taking? And so I ended up taking classes that were a little less rigorous. That way I would make time for the practicum experience.
Thank you. And I'm now going to open things up to our audience. So feel free to just jump in if you have a question, or you can put it in the chat and I'll read it out, whatever works best for you. All right, I will ask another question and let things sit for a little bit. Feel free to add to the chat as we're continuing our conversation. Throughout this conversation, we've been hearing a lot of really great advice from all of you already, but I'm curious if there's one thing that's really stood out to you that you learned from someone else that you're working with, or that you've discovered on your own that you would want to pass on to folks who are going to be undertaking fieldwork.
I think finding a mentor that's going to work for you for me, that was more important than the specific topic that I was working on. And so being able to work with June, this faculty that I've been working with, we really clicked, and I felt like she had my best interests at heart at all times. You know, and through her, I've been able to meet other folks who have also been kind of like watching out and sending me opportunities. And I think that that was the best piece of advice that I wish I had known earlier and that I could push forward to you all.
I can jump in. I think for me is take advantage of faculty office hours just to kind of brainstorm ideas you may have either for your thesis or practicum. You know, when faculty members say, you know, come see us, come talk to us in the office, like they really do mean it. And I really do appreciate, even with our global health department, where there's really such an open door policy where you can really just talk to any of them and brainstorm ideas. So take advantage of that. And I think the other key thing is when you have a practicum with whatever organization you have, and I think it's been such a great learning for me, is to really establish a strong working relationship with the people you're working with, because you just never know where it can take you after the practicum. I think with me and my experience with the Bill and Melinda Gates Foundation, I took time to kind of do coffee chats with the people outside work. I'll just like set up meetings and be like, can I have a coffee chat with you just to get to know you more and get advice about, you know, careers I want to do. And I took advantage of that with my organization, even though it was online. But through that experience, like a few months later, I just recently got an email and I've just gotten a grant from the Gates Foundation to do work around gender equality in Malawi and advocacy. So you really never know where it can take you by just really talking to people and building those relationships with organizations you may work with for your practicum as well.
I definitely agree with everything everyone said. I also, one thing I found useful is a lot of the PhD classes I've taken a lot of classes through the Center for Social Science and Statistics, CSSS. And a lot of those classes, they have final projects for them, or a lot of classes in general have projects that are really often designed to be related to your dissertation work or something. So trying to combine those projects with stuff you're already working on has been really useful for me, because then you're killing two birds. It's just, yeah, I think as much as possible, trying to strategize in advance and getting the data sets together so that it will help you in your work. It can be super efficient.
Yeah, I completely agree with what everyone has said so far. And also connecting, I think Mita talked about this, but connecting with other people who are like learning from the skills of people on your practicum team. For me, I had worked at IHME for 2 years prior to starting practicum, or 1.5 years prior to starting to practicum, but hadn't really connected with people who weren't on my particular project. So by working on the COVID-19 task force, I worked with people who are on the GBD, which is my normal project, and people who are on the local burden of disease and the evaluations team, and really learned how other people think about data science in a way that I hadn't previously approached, because it was something that I just wasn't exposed to. So I think that, yeah, talking to people and connecting, and I learned from my supervisors, but I also learned from my peers so much more than I had expected to when I went into the project.
Thank you all. That's fantastic advice. We did get one question in the chat. Can Mita speak to the PhD experience more and balancing the time between work and school, especially the first year?
Yeah, I think it really varies for everyone with their RA-ship, but I think with, you know, at the PhD level, we're really told that coursework isn't our priority anymore. Really, research is, and I've found it kind of hard to not focus on coursework. But I think I've tried to, with coursework, kind of give myself time limits for assignments and things, and just yeah, I think the first year, because it was so new for me trying to balance this much at the same time, and it was easier because I was going into the office, but I just kind of had my schedule set where I would go into the office for 4 hours in the afternoon. So it was basically like my mornings were in class, my afternoons were at work, and then because we work 20 hours a week, and then a little bit in the evenings for homework, and then just, you know, setting a time limit, because sometimes with homework you could spend as much time on it as you want, but I think just have to kind of figure out that maybe now at this stage we're prioritizing research over the coursework, so just trying to get to, you know, like 90% or 80% on your work, and then moving on. And yeah, so I think it also really varies with the RA-ships that people have, because the IHME ones, I think people, you know, they go into the office for 20 hours a week. So it really is, and you have meetings and you're on this team. So it is 20 hours. While I think with other RA-ships, it could be fairly flexible. And I think some of my friends have experienced that. So, you know, where they're funded, but they have some deliverables that they're doing, but it doesn't always add up to 20 hours every week. So I think you can also get a sense from the PIs of what their expectations are. And if you, during the first year, want to focus more on coursework, I think it's good to talk to a few different PIs about what they have in mind for the RA-ship. I don't know if that answers everything, or if you still had additional questions.
Yeah, feel free to follow up in the chat if you do have follow-up questions. We got another one. Someone would love to hear about some highlights of practicum experiences, or what has stood out to you as something that's a really unique experience that you've had.
Something I loved about my practicum was getting to work with folks in other departments at the University of Washington, as well as other schools. Like I work really closely with folks who are at the Department of Environmental and Occupational Health Services, as well as the College of the Environment and Forestry Sciences. I think that's what it's called. And it's been really cool because I get to talk about forest health with some folks. I get to talk about determinants of health with others. And it's just a really kind of like broad, holistic perspective to this health issue, which in my mind is kind of the future of public health, is really working on interdisciplinary teams. So that's been a really cool highlight of mine, is getting to just learn about things that I totally didn't see myself going into learning about in my grad school experience.
All right, we have another question. So Mita, can you share your funding journey for the PhD program? And I think I will open that up a little bit more. If anyone had funded fieldwork, I'd love to hear about that too, about if you looked for funding for your fieldwork or found it somewhere, all of that.
Yeah, I can start with the PhD program. The metrics, the global health metrics, it's funded for 4 years for the year, but not the summer. So it's like we already know that we're going to be doing these RA-ships with IHME for 3 quarters per year. And I think in the implementation science, they don't upfront tell you that you're funded, but all of my friends in that track have not struggled at all to find RA-ships to be funded. And those RA-ships, they cover not just a stipend, but also it covers your tuition, and then yeah, you have health insurance and things, other benefits. So I think, yeah, I think most people I know said that they sent maybe about 3 emails to be able to find an RA-ship that they were happy with. So that I think yeah, and there's also this other opportunity I think it's both for MPH students as well as for PhD, would start. I don't know the exact details. Maybe Sarah, you're able to talk about that more. But there's a lot of funding opportunities.
I don't have that information top of mind. I'm kind of standing in for PhD management right now, but feel free to follow up with me or with Mita afterwards. We can put our email in the chat. I can find some more information. And then did anyone have a funded fieldwork experience?
Okay. I did, just in terms of like working as an independent contractor. And I just asked to be paid, which never hurts. And I'd definitely recommend to anybody. I can't, thanks Nora. I can say like I went into my MPH unfunded and have thus far only paid for 1/4 of grad school because I've been able to find teaching assistantships as well as applying for the FLAS fellowship, which is a foreign language and area studies fellowship. So it covers, I think, about 20 different languages. And so if you speak at any of those languages at an intermediate or advanced level, you can apply for that fellowship, which includes full year of tuition as well as a living stipend. And so I just want to flag that. I think applications have closed for this year, but for like your second year of your MPH or PhD, it's an option.
That's great, thank you.
And there are a lot of funding opportunities from the Global Health Department. But I think for this year, like a lot of the field, they weren't able to do a lot of these like field practicum awards, unfortunately.
I'll type the name of the fellowship into the chat and then send a link.
Great. All right, we don't have any other questions in the chat. Is there anybody who wants to shout out a question? Let's leave us a little bit of time. All right, well, I will ask a last question then before we wrap up. And that is, so we heard from Takala about the grant that you got, but I'm curious if there's other opportunities that have kind of emerged out of your fieldwork or that relate to your plans after the program, even if that's just helping to shape your interests or your direction.
Gosh, that's such a tough decision. I'm just only trying to graduate right now. Not thinking ahead.
Fair enough.
But I must say, I think, I came from a background of being a social justice lawyer and doing a lot around public policy and women and girls' rights. And my journey with just public health and then going through my practicum with the gender equality team, I really had put me in a place where I'm like, wow, I really want to do more around gender. There's so many avenues around it. And I think, when you think about different coursework that you have even through your MPH, I remember problems in global health where we were just talking about the issue around funding, and I'm working with a foundation that is funding almost everything around global health, and just dynamics there. It really got me thinking a lot, especially being with institutions where you're seeing a lot around funding global health, and especially working with issues of gender equality and how a lot of issues around gender is not well funded, especially when it comes to women organizations. But I think just working with able to be inside and engaging from inside, I did kind of influence a lot of some of the grants that they're rolling out with the equality team, and it really opened up my eyes in terms of I want to do more around gender issues, but looking in different kind of areas and sectors around public health. But it also, I think also with my thesis, having to have challenged myself to look into a completely different topic like neglected tropical diseases has really kind of also made me think of how, there's so many linkages, like that with whatever work you're doing. So even though I'm focused on public policy related issues and I want to get into gender, doing something around neglected tropical diseases, I've already found a link around, oh my goodness, gaps in policy and even how women and girls are affected in this area and so forth. So I think going forward, I'm very interested to continue to do things around gender, but also working with governments to improve funding. Because of working with an organization like Gates Foundation, I'm now like, oh, we need to work very strong with countries to improve domestic resourcing, to have more independence. But yeah, I think a lot of these experiences do shape a lot of your career goals. And that's definitely what has happened to me. I think with just sharing with key people within Gates Foundation in terms of wanting to do more in gender equality, kind of led them to support my vision and the grant that I've received for this year around gender equality in Malawi. So yeah, let's see where it takes me.
All right. Well, I think we can start to wrap up. First of all, I want to say thank you to all of our panelists. This was really wonderful hearing your insight, your advice based on your fieldwork. And I also want to thank our audience for the good questions and for engaging. So thank you all so much. I hope you enjoy the rest of visit days, and feel free to reach out to me if you have any other questions about things that have come up today. All right.